Well, welcome. We have a few of our attendees here, so we'll go ahead and get started. I want to be cognizant of your time. Thank you guys so much for being with us. If you found your way here, you're interested in the Society for Immunotherapy and Cancer's 2021 conference coming up in just 3 weeks. And we at LARVOL have some tips and some tools and ideas for how you can use digital tools to better prepare, especially for the competitive intelligence aspect of this important conference. So my name is Abby Fraser, and I'm the VP of Marketing here at LARVOL, and I work with Dr. Mark Gramling, who's here, our Director of Oncology. He's going to give us a walkthrough of one of those digital tools a little bit later. But until then, I will just kick it off. And we do have a chat. If you have questions or you want to interact with us, I have that pulled up. We're also recording this, and we'll send it to you via email. So if you miss anything, no pressure there. If you don't know, Mark or I or the LARVOL team, it's nice to meet you. We have been around since 2004. Well, Mark and I have been around much longer than that, but the company has been around since 2004. We work with all the top pharma companies and lots of small and large biotechs as well. We have about 150 team members all over the world, and we're totally remote. We have been since pre-COVID. And our focus is really on the data that life science teams need to make strategic decisions. So we have an expert team that focuses on collecting that data, curating it, getting it into your hands at great speed so that you can make decisions using it. And that's all corners of life science, KOL monitoring and engagement, clinical trial results. And today we're really focused on that conference attendance aspect. So we're going to dig into that. Conferences are obviously very important to pharma and to the oncology community in particular. It's when the wealth of data comes out all at once and you can really see things move along in drug development. So when I started to think about this webinar and think about, talk to our team about how our customers best prepare for the CI aspect of conferences, I kind of thought about it in 2 buckets. One, what do we already know about SITC today on October 21st, if you're watching live, and that event and what's unique or special about it? And then 2, what can you do to prepare? How can we support you? And how do we support our existing customers with preparing for and using the data that comes out of that conference? And as we dig into that with our customers, we see there's pretty much 3 key areas that we can support you with. One of those is proper planning ahead of the event. And then there's access to compliant data you can use as the event is happening and following it. And then more recently, in the last couple of years, there's this added layer of social listening. And there's several ways to approach social listening. There's just kind of looking at the hashtags and the raw analytics. And then the approach we've taken is to look at the opinion leaders in the oncology community. We've identified about 1,700 of those. What are they saying about the trial data or the conference itself? So that's the angle we've taken, and we think it's a pretty smart strategy. So that's what we're going to talk about. What do we know already, and how can we support you in that effort? So what do we know about SITC today? It's in about 3 weeks, so we know quite a bit. On October 1st, they released the preliminary titles information, and that gave us a wealth of data. We know there's over 6,000 abstracts already on the docket, and those include over 800 unique products and over 2,000 unique clinical trials. So there's a lot of really important data coming out. We also know a lot about the format of the event. It's a hybrid event. So I know in the last year and a half, we've had a lot of just pure virtual events. Before that, mostly all in person. So this idea of the hybrid event is possibly new. And if you're attending it both ways, I'd love to hear how that goes. But I found this information from SITC, and I thought it was important to note that while the in-person attendees will get access to everything both ways, if you're attending virtually, the key thing you'll be missing is that networking aspect, right? You won't be running into people in the halls or having kind of impromptu conversations. And that's been really interesting the last year as virtual events have happened. The networking has been hard to replicate. It just doesn't happen in the same way. And where we sit, that makes the data even more important. You're not going to SITC online to network and hang out with friends. You're going for this data. So that kind of amplifies the importance of what we're trying to do, and I think is an interesting aspect. So that brings us kind of to our first digital solution to support your pre-conference attendance. And that's the conference planner. We call it COMP for short because we like 4-letter titles and like to shorten things. But the COMP planner is really a comprehensive, it's a spreadsheet style tool that gives you all the details on the event before it happens. And then we update it regularly as it happens. So it includes when and where these sessions are happening, obviously, also links to the full abstract, and then detailed columns on what products, what MOAs, what diseases, what companies are being mentioned in this abstract. So you can easily sort and filter for the data that you're looking for, and that helps you decide what to attend or what to prioritize in follow-up. And what's really important about this is that kind of iterative process of the planner. So we send it again and again to our customers as new data is added. So as I said, on October 1st, preliminary titles came out. Our team immediately profiled that data and built the initial planner and sent it out to our customers. And we would love actually to send it to you as a gift for this webinar. And I'll tell you more about that later, but we'd love your insight on how useful it would be for you. As we look ahead to like November 1st, when late breaking titles come out, our expert team will again look at the data, profile it, and update the planner and send it out to our customers again with the information highlighted that's been added. And again, when regular and late breaking abstracts come out, and even during the conference as oral abstracts reveal new data, and following the conference with post-conference Twitter activity. So they do this again and again and at speed. So typically less than 36 hours from the time it comes out to when it's back in your hands. And hopefully that saves you a ton of time on the initial kind of processing of the data. So that's the kind of COMP process and system. And we can see it here. Here's just a couple screenshots of the existing SITC titles planner that as I said, I'd love to send you after the webinar. But you can see it's sortable by date, by the session type. You can easily filter any of these columns and they go on from here. It's a very large document. And there are additional tabs for product, MOA, and disease analytics. So it's a very powerful, comprehensive tool. And one thing I've heard our customers say is that it's easy to manipulate and share and make it work for them. We can even customize it. So that's a look at the planner as it is today. And as I said, we're looking forward to November 1st when the next one will come out. But what's interesting about oncology conferences in particular is we've added these 2 additional layers of data. The first of those is the trial documents themselves. So we take a look at all of the abstracts and those that have to do with clinical trials. We pull out every single chart, figure, table, graph, KM curve that is presented, and we make them easy for you to access. So you can click right from the trial document link in your planner, open a new tab in a browser, and have easy one-click access to all the images and documents that were shown. In addition to that, we have another layer where as I said, we're looking at the Twitter activity of these 1,700 digital opinion leaders. If they're reacting to the data from the conference or from these trials, you have an easy access to that as well. And you can see even the sentiment of what they said. Are they positive, neutral, or maybe even negative on a trial? So that's 2 really powerful additions that we do in these planners only for oncology events like SITC and ASCO and ESMO. And we're able to do that because we have a whole nother solution, this broad platform database called CLIN that is doing that same thing for all clinical trial data. And so why I've asked Mark to join us is to take a look at what else can you see when you start to look across conferences at the clinical trial results in particular, and what kind of access might that give them in the competitive intelligence space. So I don't see any questions yet, so I'm just going to pass it over to you, Mark, and I'll stop sharing and let you sort of drive for a little bit.
All right, can you hear me okay?
Yeah, sounds good.
Sure, so thanks Abby for including me. I wanted to hone in on what Abby's really set up quite nicely, which is what is that broader platform of those Twitter reactions and all of the documents for a particular trial. So, if you're engaged with us at a conference planner, you're going to get a very directional line for each, part of the conference planner that you have purchased or you've worked on with us. but CLIN is sort of the global tool of where that data is. And I will share my screen. I'd love to just take about 10 minutes or so to give you the very 10,000-foot view of what CLIN looks like, what parts of CLIN will look like when the data is available for SITC forthcoming, and to give a little bit more color to that social media element that Abby mentioned about the 1,700 oncologists we're following. So let me share. Hopefully my screen is visible.
Yep, looks good.
So I'm less of a slide person, so I thought we'd just go live demo to show you our CLIN software. So here's just a landing page of CLIN, and just to demonstrate some very basic principles, and then I'll jump through to some of the functions. You know, the directive of CLIN is to fulfill that the unfulfilled promise of CC.gov, which is having all of the trial data in one spot, whether it's from conferences, which we're talking about today, or from the peer-reviewed publications, or from press releases covering things like regulatory developments. And so what we aim to do is allow you to search all of that, all data, as this tab says on the top left, to look at all of that. But to just get it into it and structurally in terms of a conference, because that's sort of the spirit of today's conversation, just wanted to show a list of some of the conferences that we cover. So these are just chronologically listed right now. So you can see we cover a variety there as well. But just to maybe just get straight to, because, okay, we cover these conferences, Mark. Well, what do you mean by that? So how about I'll just jump quickly over here to what this data looks like, what it did look like for ESMO, which we covered in real time, and which will be doing the same thing for SITC. So during the course of that conference, whenever what we call documents, which you can see here, these panels are coming out, we're processing those in real time within 36 hours to put them all in one spot so that you can review them. So that's the most basic principle of what we're doing with CLIN, is the manual curation in real time needed to cover all of the trial data that is public. And we are compliance sensitive, as Abby mentioned. So if as our analysts are processing these documents, if they're able to access them in the public domain, then you're going to have a full resolution. If the particular document is, you need a login from your institution or whatever your construct may be, then we'll provide you a thumbnail. So that's when Abby mentioned compliance earlier, that's the basic meaning of that. So we can pull all of those documents together to give that to you in one space, especially in a virtual context, or quite frankly, in an in-person context. You can only be one spot at one time. So if you want to have that real-time exposure to the data itself from SITC, then we'll be able to provide that on this platform. So it's accessible either via the conference planner and the Excel and the link that Abby showed, or if you engage with us or are interested in the CLIN broad platform, you can go to an online platform and do the searches yourself by condition or intervention, etc. So just scrolling through, I'll try not to scroll too fast, as that might cause nausea on a Zoom. But this is the type of documents we're covering, and this is all focused on ESMO, but of course we cover all the public data from conferences to publications, etc. And then to jump a bit, the social media and that social listening element that Abby mentioned, for the planners, we have that post-planner Twitter reaction summary. But what we're doing at CLIN, because it's so trial-centric and so trial data-centric, is actually linking the reactions of those oncologists to the data releases. So in this case, this Destiny breast trial happened to be the most tweeted about release at ESMO. So if I were to jump over here, you can see the sentiment analysis that Abby was referencing earlier. So here it's not the, so here it's the same construct, but here seeing in the platform, all of the quote positive or negative or neutral reactions to a particular data release. So it's all right there in one space you can find the trial name, You can find the trial documentation that came from the Congress, and you can go straight to the tweets, which are also being processed in real time. So I wanted to mention that as well. So all of this is being pulled together in real time during the Congress itself. So that's sort of the first quote unquote layer of the rocket, and probably the most applicable to conference coverage, based on this webinar today. So getting all of this to you with speed, with accuracy, being compliance sensitive, and also having those social media reactions. So that's really the core of what we're doing with CLIN to complement the conference planners. But I would be remiss if I didn't talk a little bit about another element of what we do subsequent to, but very quickly, immediately after, is actually digitizing outcomes data coming from trials. So here you can see the data as presented, whether it's a screenshot of a poster or a screenshot of an oral presentation. But a huge element of what we're doing with CLIN is wanting to digitize outcomes data, OS and PFS, to put it in a fungible model. So this is not, I haven't searched this by Congress, but I actually have just done a search very quickly for CAR-T. And to illustrate what we're doing with this digitized data is I've actually selected through from the trials that came through from our global search, and we've digitized around 25,000 OS and PFS curves in our system. And I've just clicked through and went to a couple CD19 targeted studies, as well as this Juliet study in diffuse large. And to illustrate the principle is that digitized data can be put on one screen for a sort of a meta-analysis in a box. So first step from a SITC is, of course, getting all of those documents, which we saw on the prior screen, out to you in real time. And the next level of the process is digitizing all of that data collectively, along with all the other data we have in our system, to make comparisons or visualizations, at least, based on what you're seeing here. So this is, again, just a quick search, applying CAR-T therapies in and amongst non-Hodgkin's versus diffuse large versus leukemia. That's mostly I just wanted to illustrate visually what's going on here. So there's some complexities in doing this type of analysis. And of course, we're going to link you to the original data source. So as I go through here, just for example, we're going to give you the additional details. We're going to give you the thumbnail or the high-res image to find the curves and allow you to access or allow you to click through to the source. So that's what we're doing in the construct of Kaplan-Meier. And then similarly, if I did a similar type of search, actually with this search, I just looked at lymphoma earlier, and actually at the same Juliet study, we have the comparable hazard ratios for that data. So in addition to digitizing the curve itself from the public data, we're also going to take from the publication and digitize the hazard ratio. So both this visual you're seeing here, as well as the prior visual, that's completely constructed from our software. So that's what we're doing with the hazard ratios, and you can calculate a composite, which we worked on with one of our biostatisticians. But really, to me, it's all about making those comparisons, going down into the details of individual curves and individual trials, and making that assessment. So it's the next level of that coverage. But again, the primary focus, I think, for this audience would be that real-time coverage of this data and getting this to you quickly within 36 hours, if not before. But finally, and then I should certainly quite pause for any questions in the chat. I just wanted to show as a visual, I referenced those tweets earlier, but when we say we're covering 1,700 plus validated digital opinion leaders, these are the individuals we're talking about. So we actually have them ranked in the system, just as a reference in the system. We use an algorithm based on their online or online and offline activity and references and things of that nature. But I just wanted to very quickly put faces to the construct of what we mean by digital opinion leaders. So these are the people we're tracking and curating on a daily basis. So I think I'll pause there to see if there are any questions or if anyone would like me to elaborate via the chat box on any of the features of CLIN, or any questions for Abby or I with regard to the conference planners.
I don't see any questions right now, Mark, so I might take back over and show my final screen, but that was perfect. I know at some of those conferences, if you'll click back over to conferences real quick, if you're still sharing, some of the top ones were smaller, but when you get down to ESMO and ASCO and things, I know there were hundreds, if not more, abstracts. Yeah, that becomes very powerful to be able to see all those documents in one place. Definitely.
Sure. And yeah, you know, certainly for your ESMOs, your ASCOs, you're going to have more in the high hundreds. Now, important point is that we're connecting clinical data releases to titles. So certain congresses may have more preclinical data, or they may have meta-analyses or things of that nature. So it's not necessarily a one-to-one comparison, but from a conference such as an ESMO or an ASCO with just the bolus of clinical data releases that come from them, that's where we're going to have higher figures. So
yeah, that's helpful. If you will stop sharing, I'll just throw one more thing up there, and there we go. Screen. Awesome. Thank you, Mark. I learned something every time you walk through CLIN. But we're coming close to the end of our time, and so I just wanted to kind of go over what we'd love to give you as a thank you for being here, or as a way to dig further into what we've shown you. So we will get an email in the coming day or so with details, but we'd love to actually let you get your hands on that titles planner that I showed, so you can think about SITC from a pre-Congress planning perspective and look at some of the data and think about whether additional planners might be useful to you. And then we'd also love to give you access to that full CLIN database that Mark showed. With 2 months of access to that, you'd be able to look back at past Congresses like ASCO and ESMO, like we said. You get SITC coverage, and then I think you'd even get into ASH and San Antonio Breast and some of the other large events coming up. So we're very eager. It's a new platform for us this year, and we would love your feedback on it. We'd love real world use cases as we're getting from some customers now. But those are the things we'd love to put in your hands so that you can kind of practice what we just preached as far as planning with a tool like Conf, and then having access to the data in a compliant way and having that layer of social listening. So we'd love to share those things with you as follow-up, and please feel free to reach out with any questions or suggestions. And thank you, Mark. Thank you guys for being with us, and hope you have a great rest of your week.
Thank you all for joining.